So I am delighted to introduce a friend and colleague of mine, Dr. Sharon Stevelink, who is a reader in epidemiology based at the Institute of Psychiatry, Psychology and Neuroscience at King's College London. Sharon's going to talk to us today about PhD opportunities for health and non-health professionals at KCL and other opportunities as well. So if we hold questions until the end, that would be helpful. Sharon, over to you.
Great, thanks, Vaughan. And hello, everyone. I'm delighted to see some of you here. So as Vaughan said, I'm going to talk a little bit about PhD opportunities, and I'm working at King's, so I know a little bit more about offering at King's, but I'm also trying to discuss a few more opportunities that might align also with the vision and mission of the London Centre for Work and Health that might be of interest to those who are attending today. And as Vaughan said, I would appreciate it if you hold your questions till the end, because also I can't really see when people put up their hand. So I hope I can talk for about 30 minutes and then we have 10 minutes for questions. So I was thinking it might be important to start also a little bit with the basics of a PhD, especially for people who are still considering whether they would like to do a PhD or not. So in the UK, we have self-funded PhDs and also funded PhDs. So in general, the difference is that with a funded PhD, your university fees and a stipend, what's a little bit like a salary, are accounted for within your PhD grant. And often this grant also includes research costs and a training budget for the PhD student. If you are self-funded, in general, it means that you need to pay the university fees and also you don't get a stipend. And also any research cost or training budget, it may have come from your own resources, or you need to go out and find additional resources to cover that. It's important to know that also for international students, in general, universities charge higher fees for international students if you want to do a PhD than if you are a more like national student in this sense. Some of the funded PhD programs do allow to cover the international fees, but often these the number of positions available for international students is capped. So for example, if a program is offering 10 funded PhD students, they may only accept 2 international students and pay the fees accordingly. It might still be that you get offered that PhD, but they might request you to make up the difference in fees, but can be quite substantial. So in general, PhD recruitment follows the academic year or the academic cycle. So most often it opens recruitment in autumn, and then you need to put your application in, you might have an interview, and then you have a start date in the next academic year. So in general, the academic year starts in October each year. Then PhDs can be supervisor-led or student-led. If it's supervisor-led, it often means that a supervisor has put a PhD proposal together. They develop the PhD questions, what they would like to research, what methods they are going to use, or what methods they would like the student to use. So the supervisor has decided upon the idea and how it gets executed. However, if it's student-led, in general, the student comes up with the idea. And this might, of course, be in discussions with the supervisors who may help steer the students to come up with a well-rounded PhD proposal. So an advantage, of course, is that the student can really make the PhD about something they're very passionate and interested in. Most PhD are 3 or 4 years in duration. It depends on the program. And in general, a PhD will allow for you to do this full-time or also part-time. One very good website in general also to find a PhD, what's quite generic, is findaphd.com. But I'm sure there are many more websites, but it's just one example to maybe start off exploring and seeing what's out there. So now I'm going to discuss the PhD programs that might be available to you in 2 parts. First, I'm going to discuss some PhDs that are specifically directed at health professionals. So you need to have a certain qualification to be eligible to apply. So I listed 4 here, and again, this is really King's focused and things that I'm aware of. So there might be several more out there, but it will just give you a gist of what's going on. So let's start with the King's PhD program in mental health. So this is a program that has been established in 2021 and is technically funded by the Wellcome Trust. So it's available to doctors, nurses, clinical psychologists, and allied healthcare practitioners. And in this case, the topic of interest has to be relevant to mental health science. So they have 4 themes: translational neuroscience, data science and digital technologies, society, policy, and mental health. So examples of successful PhD students who got a PhD via this program are, for example, people who examine sleep disturbances in children, but also exploring inequities in child and adolescent mental health care services access, and also the impact of certain medication on major depressive disorder, for example, just to give you a gist what might get through in this type of PhD program. So in general, it's 3 years salary, full-time, and this is in line with the clinical salary that you might have been on anyway if you would have stayed like in your role. And the program, there are 3 stages to go through. So the first stage is currently open with a deadline of the 15th of November. So if you're interested in possibly in this, there is a link for some more information. Then we also, of course, the NIHR, the National Institute for Health and Social Care Research, is actually quite a big funder of health-related PhDs. And they have the Integrated Clinical and Practitioner Academic Program. So this is available to health and social care professionals, but it's excluding doctors and dentists who have their own programs. So you can receive funding for 3 years full-time or up to 6 years part-time. And in general, how that looks like in practice is that 80% you work academically, working on your PhD, and about 20% you probably might still work in a clinic or spend on other professional development opportunities. So in this case, you need to ensure that you have the support of an English health or social care provider. So in practice, this means you need to have a contract with, for example, a hospital or wherever you work for the duration of your PhD, and also a university. The competition for this one opens twice a year in March and September. And in general, it's like a written application followed by an interview. And often this is standard practice in PhD landscape. So you need to have a written application, and often you get invited to attend for an interview, and then you will find out whether you have been successful. So there's also a link here on the slide that gives you more details about that exact program. I also think it's important that that we flag that, of course, a lot of you have very busy jobs as health professionals, so you might not even have the time to think about a PhD proposal, because this one is student-led, so you need to come up with an idea. So the NIHR has also 2 bridging schemes that you could apply for. So it means like you can buy out some of your clinical time to actually spend a few months writing up your doctoral application. So it's a pre-doctoral clinical fellowship and a practitioner academic fellowship. And one gives a little bit more time than the other one. So if you're worried of like carving enough time out to put together a good PhD proposal, definitely also look into these kinds of bridging schemes that might help you manage to put something together that's of good quality. Then also, most recently, the NIHR has launched a doctoral local authority fellowship scheme, because they noticed that there are also a lot of allied healthcare professionals that might work in local authorities and supporting services, and they're very keen to grow the research infrastructure and capabilities in that setting as well. So it's available to individuals who work within local authorities and supporting services, and it's excluding doctors and dentists. So it's my understanding that you need to work within that setting and don't necessarily need to have some sort of related health qualification. So again, it's funding for up to 3 years, up to 6 years part-time. a similar approach as the previous program from the NIHR. It's expected in general that you work 80% academically, so working towards your PhD, and about 20% you still work for, like your local authority or the supporting service, or dedicate more to professional development. Of course, you need to have the support of your local authority or supporting service, and also an English university needs to be able to host you there. And I think it's quite important that when you decide to go down this route, that you find a university that can support you properly over the course of your PhD, so that the supervisors and the infrastructure or the data sources that you may need fit with your PhD proposal. Because also the NIHR wants to know that you are in the right environment to complete your PhD successfully. So this is an annual competition. It opens in September with a deadline early December. And you can have a link there with more information about this type of fellowship. And again, also for this one, the NIHR offers some bridging schemes that may help you to work up a competitive doctoral fellowship. So it's called the Local Authority Spark or the Pre-Doctoral Local Authority Fellowship. So you'll also find more details about these options on the NIHR website. And then also at King's or the Maudsley BRC that's attached to King's, we also have a pre-doctoral training for clinicians. So this is not necessarily a PhD, but it helps you to obtain, hopefully, an externally funded doctoral training fellowship. So it's available specifically to medical trainees in psychiatry and neurology and other healthcare professionals. So this will help you to establish a necessary research track record, the skills, and also identify support to compete and put together a competitive doctoral training fellowship. In general, this is 12 months full-time, and it will cover your basic NHS salary and also gives you a small budget for training, conference presentation, and some research consumables that you may need to deliver on, like the research questions that you want to address in those 12 months, as well as like hopefully then write up an application. So in general, the competition of this opens in autumn 2023, and I'm pretty confident that by the end of this month it will be open, and you can again find more information via this link. So I just discussed 4 options that were only open to health professionals in general, and now I would like to discuss some options for non-health professionals. However, that does not mean that if you are a health professional, you can't apply for these schemes as well, but it might be that, for example, your clinical salary doesn't cover because you just get the stipend, or there might be less flexibility, for example, to still keep your clinical work going. So I pulled out 5 schemes that I will discuss with you. So one of them is the King's or the NIHR Maudsley BRC Translational Research in Mental Health and Neuroscience. So in general, for students, it's required that you at least have a 2-1 or an equivalent overseas qualification. So in general, this refers to your bachelor's qualification. And of course, you also need to meet the standard university language requirements in English. So specifically for this scheme, there's a focus on translational research and experimental medicine in the areas of mental health and neuroscience. So for those who are not that aware of the NIHR Maudsley BRC, this is a research infrastructure that really closely works with the South London and Maudsley NHS Foundation Trust, who are one of the biggest European mental health care service providers, hence the focus on mental health and neuroscience in this case. So these PhDs are available for 3 or 4 years full-time. It depends a little bit on the type of PhD, whether you can go for 3 or 4 years. There are only a few overseas positions available, so meaning that when an international student applies, there are only a few funded PhD positions that will cover their full university fees that are higher than national students. So the competition opens once a year, in general winter and spring. It's supervisor-led, so in general, supervisors within King's or the NIHR will submit projects that go in a portfolio. And then as a student, you can apply for, say, your top 3 of your projects. If you then make the shifting based on your paper application, you will get invited for the interview. So here again, there's some more information embedded in the link on the slide. Then we also at King's are part of the LIST DTP collaborative studentship competitions. So again, you need to have a 2-1 or an equivalent overseas qualification and need to meet the English language requirement. So in general, these PhD studentships are funded indirectly by the Economic Social Research Council. So they have a more social science focus. So that's where they are a little bit different to the NIHR, who seem to have more of a health focus, just to give you some indication where this sits. So in this case, if you're successful in obtaining a PhD, you might be able to secure a 1 + 3 years PhD, where you will also be able to do a fully funded master's relevant to your PhD, and then subsequently start your PhD. And the master's can take place at King's, Queen Mary, or I thought Imperial College, because that are the 3 universities that are collaborating as part of this LIST DTP competition. Or if you, for example, already have a master, you can just do 3 years of a PhD. Again, there are only a few overseas positions available. And what I really like about this studentship scheme is that you have a LIST DTP open competition, so it's student-led. So the student can come up with an idea, submit the idea, and then may be able to receive funding. But also there's a supervisor-led PhD strand, whereby the supervisor will come up with the proposal, but also in general, it includes a collaboration with a public, private, or third sector organization. And this can be that they provide financial support, but most often you have the chance to work for about 3 months with this organization. So you will do a secondment. So we successfully have collaborated, for example, with the Department for Work and Pensions, but also NHS England and Improvement, who provided a 3-month secondment for the successful student. But I think is really beneficial to also see, like, how can your research that you're doing, how can that be of use outside academia, and what impact can you achieve by doing, for example, such a secondment, and of course also very good for professional networking. So for the case studentships, student recruitment starts in January 2024. And for the LIST DTP open competition, again, this should open end of October, early November. So there are some links on this slide as well where you can find more information. Then at King's, we also have an MRC DTP PhD program. So again, it's upper second class honors degree or also relevant professional experience. So for example, if you're, for whatever reasons, if your grades are not that, may not meet the mark, but you do have a lot of professional experience, it's worth checking in with the funder or whoever runs the scheme to see, for example, if you've worked for 10 years in the NHS, whether this will also help you to meet those eligibility criteria. Really, over the last few years, funding bodies have been much more aware and receptive to alternative career trajectories. So I would definitely also now and try and get in touch and see whether, despite that on paper it may not look like you meet the criteria, there might be some alternative circumstances that will still allow you to apply. So the King's MRC DTP PhD student scheme focuses on biomedical and translational sciences. So again, it's 1 + 3 years or 3+, and only a few overseas positions available. It's supervisor-led, so supervisors will put PhD proposals forward, and then as a student, you apply to that. They also have an industrial case studentship. So, for example, often students will go for a 3-month secondment, and I've seen programs advertising, for example, a 3-month secondment with a big pharma company, what can be quite interesting if you're interested in biomedical science. Competitions open in autumn each year, and then again a start for the next academic year, and you can find some more information at the link on the link provided. I think it's also important, considering the vision and mission of the London Centre for Work and Health, that we should mention the Colt Foundation PhD fellowships. So they have a focus on occupational and environmental health. So in general, this is 3 years full-time. It's student-led, so the student applies with the ID to Colt. The competition deadline in general is in August each year, and they also run an NIHR called Advanced Fellowship Scheme. So if you have done a PhD already, but would like to do a postdoc in occupational and environmental health, Colt might also be able to fund that. So an example of something Colt funded, one of my students looks at adjustment disorder in the military that was kindly funded by Colt. So you will also find some more information on the link included. And then all the examples I gave are, there's probably much more, but it's also important to acknowledge that there are quite a few big funders who are very interested in funding doctoral fellowships. So I just mentioned a few here, and I just want to say this is a non-exhaustive list, but considering work and health research, this might fit well with the vision and mission of, for example, the NIHR, the MRC, or the Wellcome Trust, as well as the ESRC, who run doctoral fellowship funding applications in general several times a year when a competition opens. So in general, these are student-led, so you will have to come up with a project, and you need to find a host university and supervisors to support you throughout the PhD. And also, I think student-led, it's not that the onus is all on you. So if you have an idea and you want to grow it and discuss it and maybe put it into a fellowship application, get in touch with people at your university or ask around or send some emails, because often people are happy to help you work up your fellowship application to be submitted to one of the funding bodies listed here. And of course, there's also the option to do a self-funded PhD. So if you have a topic that you're very interested in and you have developed certain research questions, you might be able to go out and approach people who work at a university to see whether they are interested to supervise you. However, it does come at quite a considerable cost, so you need to pay yourself for the university fees. You will not get a stipend, and also in general, there might be limited or no budget for training or conference attendance. So if you're in a position to self-fund your PhD, that can be good, but also it comes with some financial difficulty, so it's not always an option for many of us to do that. One thing I wanted to point your attention to is also the research support service. So, of course, when you want to put a competitive application together, you might want to have some input from your supervisors, but there are also more external support services you can approach. So the RSS was replaced the RDS in autumn this year. So that was research development support. So in general, this is run by the NIHR. So there are 8 hubs across the country, and you can ask for free support for researchers, whether you are a student or a PhD student or a postdoc, or whether you are already further down the line, who will give you advice on how to apply for funding, but also how to develop a proposal, and can even give feedback on proposals. And I've used RDS before myself as well for my NIHR fellowship application, and they even did mock interviews for me. So they really can help from pre-application to like help brainstorm ideas to post-award when you have received the funding. So far, I've had very good experiences with them. So I would definitely think, if you're serious about putting in an application for a PhD, to see whether you can get their input but ensure you do it in a timely fashion. So I just want to wrap this up, and I know it was a lot of information because actually there are quite a few schemes out there. But again, it was not an exhaustive list of PhD opportunities. Just for you to start the process, if you're thinking about doing a PhD or you already may have a topic that you're interested in, just reach out to people you may know at the university, say, oh, can I have a chat sometime? Because they will be able to act as a soundboard or can help you generate some new ideas. And you'll be surprised that most academics are more than happy to talk to you. They could then, of course, be a possible supervisor, but they can also direct you further to someone else in their team who might be better suited to be your PhD supervisor. And also for some PhD programs, there's already a list of potential supervisors that are already said they would be welcoming students to help them apply for a particular PhD project. So definitely say start early and ask for help. Really also think that the topic is really of interest to you because, well, you will be breeding this for 3-4 years. So I think it's important that it's something that makes you tick. It's important to think about your education and training needs in advance. So what do you need to be as competitive as possible to get that PhD? It might be that you will do a research assistant position for a few years or an assistant psychology post before you apply for a PhD to ensure that you increase your chances of success. And also, it's very competitive and you may just have to try a few times. So I wouldn't be, yeah, it's hard if you get a rejection, but in general, you will need to try a few times before you get a PhD that you're really interested in and you are successful. So I just want to say a big thank you. If you have any further questions, do feel free to reach out to me. And also, if of interest, we are submitting 2 ESRC case submissions for this year's. I'm not really sure whether they will get selected yet, but if you're interested, one of the submissions will look at moral injury among correctional officers and how this impacts on the health and occupational outcomes. And the student will have an opportunity to work closely with the Prison Governors Association. And we're also submitting a project together with Lambert Council that will look at social inequalities in receipt of welfare benefits using a big linked data source. So that was it for today, and I'm more than happy to answer any questions if I can.
Thank you very much, Sharon. That was an excellent overview of, I guess, the breadth of different PhD funding opportunities that are available for people interested in doing work in health research. Open this up, I guess, for general questions that people may have in the group. If you just put your hands up, I suppose just to kick us off, I have a couple of questions that I'll just like your thoughts on. So the first one is, do people need to have research experience before they apply for a PhD?
I think a lot of the programs are quite competitive. So it would be beneficial if you have some research experience. However, this can be in the form of you managed to publish your dissertation project or have presented an abstract on a conference that will set you aside from other candidates if you had a chance to do that. But I am also aware of students who did their bachelor's and master's and then straight away got into a PhD studentship, but I have to say often those students also did quite a few extracurricular activities like volunteering or like being on the board of a student organization or things like that that sets you aside.
Yeah, excellent. And I think certainly you highlighted this point that the funders absolutely value and recognise the benefits that clinicians who come with experience as health professionals can offer to their own PhD programs or research projects that they're interested in taking forward. So it's in addition to just having that practical research experience.
Exactly. I think for health professionals, it's a little bit different because they just want to grow the research capability of clinical academics. So even if you don't have that much research under your belt as yourself, as long as you are research aware, is a term they like to use, that will bring you a whole lot, further already.
Okay. Any questions from people in the group? I've got one final question, just whilst we're letting people come forward, or to put the questions in the chat box if you prefer. My other question is, what should people expect in terms of the interviews if they're invited to an interview?
Yeah, so I think in general, it's about 20 minutes, I think, 20 minutes to half an hour, where you might get some questions about your proposal or the project that you applied for, why you are suited to this PhD, so why you want to do this. But also, can you already see whether there are some limitations to your PhD? How would you go about that? Or some challenges, for example, with participant recruitment or things like that. So in general, you might have 2 to 3 people interviewing you, and you will get, I assume, advance notice 1 or 2 weeks in advance that you are selected. And they're often quite structured because in general, in the UK, we are quite good in asking fixed questions. So everyone gets the same questions to ensure that it's fair when everyone gets their PhD interview. However, it does really depend on the program. So I can only speak from my own experience, or when we have funded PhD studentships, how we go about it. Some, especially, for example, if it was a supervisor-led PhD application that you applied for, you might be asked to do an exercise. So, for example, if I would recruit a student who needs to have very good quantitative data skills because they are going to work with big data sets, I might give you an exercise just before the interview, already in advance, that we will also take into account together with the interview. But it really depends on the program, but it's more or less the same as a general job interview.
Okay.
I'd like to ask a question, please.
Yeah, please jump in.
Yeah. My question is, I work in the healthcare sector. I have an interest in doing something related. It's like a support program towards mental health in terms of work. It's work related in terms of supporting people in mental health in their recovery journey. So in that case, if somebody is applying for a PhD in that area, and they don't have a health-related research experience, with their work experience count towards that? Because I've actually got a master's as well in occupational psychology, but with their experience counts towards the application.
Yeah, well, I would say yes in general, because every experience you have is beneficial, even if it's slightly outside the area you want to do your PhD in. Because you never know, well, your work might be doing slightly different, but actually you're very interested in something else. So I don't think that that's a problem in general.
Okay, thank you.
Thank you, Sharon. Malachi.
Thanks very much, Sharon, for the presentation, and thanks a lot, Parsons, for this. My question is twofold. One is, I suppose, as students, it would be, how would I say, it would not be unusual to ask for probably more than, you should get. What I mean is this. Is in putting together a PhD proposal, which is coming from the student, him or herself, is there a sort of like a template of what a good one looks like? I know everybody will laugh, but actually, knowing what it looks like, nobody's going to copy somebody else's work and paste. That would be unthinkable, but at least you understand what it looks like, and then you can tailor yours to, to look like that, or at least reflect as much as possible. Because part of the problem, at least me, I do have, is that something you've never done before, all throughout your clinical career, you revolve around, clinical skill. During exams, you get tested with a few research questions, so you don't really get to dive into it completely. So my first question is there sort of like a template where somebody can have a look, see what, a good PhD proposal looks like? You can look at it, study it, and then learn from what you've already put together or modify it. My second question is this. Obviously, as a student, you're a student, meaning that you're not a finished product. Now, when you're coming into PhD research and you discover that there are certain skills that you don't have, for instance, myself, if you ask me, it would be, methodology issues. For some other people, it might be systematic review, but there's a lot of resources, free resources on systematic review. Does that count against you? How do you make up for that? Is it a case that, along the line, you're expected to develop that skill, but again, you need to put in methodology in your proposal? So it becomes a case of how do you get what you don't know? But that's what you need to get to where you need to be. I'm not sure if I made my points clear, and thanks for that.
Thank you. I think with regards to your first point, yes, in general, if it's a student-led proposal, there will be a template or more or less topics that you need to hit. So it can be you need to give a background, or where's the research gap? What are your research questions? What's your method, and what training needs you might have? And also, I think it's important to know that if you are preparing a student-led application, you are not alone. I suggest you try and identify supervisors early on who can help you in this process, because they will have successful examples that they can share with you in confidence, so you can see what a successful application will look like. So I think it's important that getting supervisors in place, or at least an academic who advises and helps you in the initial stages before you settle on supervisors, is very important, because I think it will save you a lot of time and frustration, and you want to get it right. It will also give you the best chance of success if you identify someone supportive. And then about the skills that you may not have, the PhD is also about training and development. So yes, we expect a basic understanding of certain things that are very crucial or essential to your PhD, but we can't expect that a PhD student knows the most novel statistical analysis techniques. That's also why we want you to do a PhD, so you can go on a training course to do that. But as long as you show that you have a basic grasp of certain things underpinning your PhD student, but also very importantly, can you outline what are your training needs? Because I think that's very important as well. If you don't know what your training needs are, you don't necessarily know what training courses you may want to do over your training or your PhD. So I think it's important that, for example, if you come from a completely social science background or humanities background and you want to do a very technical, complicated AI PhD proposal, that might raise some eyebrows. If you are a health professional and you're very interested in doing a big data project where you might want to use electronic healthcare records, but you've never worked with that or never really had longitudinal data skills, I think that's fine. But there needs to be a balance between what you bring to the table, also based on, for example, your clinical experience or your bachelor's or your master's degree, and then what you are aiming for with your PhD.
Okay, thanks very much. Thanks a lot. That's very helpful.
Thank you.
Okay, thank you very much. Any final questions before we finish up? And just following on from Sharon's closing comment, if anyone has any questions or just wants to have a one-to-one informal chat about a research idea, or people who are interested in doing a PhD, my colleagues and I at the London Centre are certainly available just to have those initial conversations, and we can assist you with identifying some suitable supervisors. And as Sharon mentioned throughout her talk, the importance of identifying suitable supervisors to work with very early on, because they won't let you submit substandard applications. They will want to make sure that your applications are of sufficient quality, that it will be considered by the funders. All right, lovely to see you all today. Look forward to seeing you again next month.
Great. Thanks, everyone.
Thank you.
Bye now.
Sharon,
Thank
just
you.
stay on.
Bye-bye.
Thank you. Bye-bye.
Bye.